Well, it is always a pleasure to welcome Dr. Cate Mills, our resident GP, into the studio. Dr. Cate, welcome.
Thank you, Steve.
Now, this thing we're talking about this week is something that I thought was only around in the 18th century. I actually didn't think it existed anymore, but we're talking about gout.
Yes. Yeah, it's reasonably common.
So, what is it?
Well, it's a sore joint, really. That's how people would know it. And it's a very, very painful sore joint, generally just one. And the joint becomes very red, hot and swollen and, yeah, acutely painful.
So is it like an arthritis?
Similar to an arthritis, yeah. It's called it's a crystal arthritis, really. So it's made. There's a small crystal, a uric acid crystal, that circulates in the bloodstream. And if we've got too much of this uric acid, we make it into little crystals that can deposit inside the joint and make the joint very sore. And it just sets up this massive inflammation inside the joint, makes the joint really, really angry inside, and it's just acutely painful. So painful that you can't sleep well at night, you can't have bed covers over the affected joint. It's very sore. So if you've ever had it, you'd really know that you've had it.
I was reading here that it often occurs overnight, and within 12 to 24 hours there is severe pain. So it's that quick.
It's that quick. Sometimes it's triggered by a small knock or a tiny injury that just kind of sets it off. Sometimes it can just come. Sometimes it may be related to food, although we think that's not such a strong association, but we know that the level of uric acid in the body can become elevated after certain foods. For example, alcohol or things with yeast in them can increase that level. Sometimes some shellfish can, or certain red meats can as well. But some people are quite particular about certain foods that will set off their gout, and they have a quite clear association between a food that makes their gout worse. So it definitely has some diet effect.
Is it hereditary? I mean, if gout's in the family, you're more likely to get it?
Absolutely. Well, what's probably in the family is a higher uric acid level in the blood, and that's probably handed down. And so some people are more likely to get gout than others, and then if something triggers it off, then you'll get a swollen hot joint. So not everybody in the family of someone with gout will definitely get it.
And is this something that once you've had it you will have it again, or can it be a once-offer?
Generally you'd have it again. Yeah. I think there'd be very few people that ever just get one attack of gout, although it may just be that we've never recognised those people, because generally you'll make that diagnosis on a history of it being recurrent. But most people would have more than one attack. Some people will get very frequent attacks and can even get pain in that joint in between attacks. And
are we talking all joints of the body, or is it?
There are some joints that it happens in more commonly, and the commonest joint is the big toe.
The big toe?
Yeah.
Why the big toe?
I don't know why the big toe.
That's quite bizarre.
Yeah.
So this uric acid stuff, how does the body normally get rid of that? Is it through the kidneys?
Through the kidneys. So the kidneys usually get rid of it, but some people will get rid of it quickly and others will eliminate it more slowly through their kidneys. So therefore their level's higher, and you get to a point where you just get oversaturated, the blood gets too much of it, has to get rid of it somehow, so it puts some of it inside a joint, and that's when the symptoms start.
A funny place to put it, isn't it? Why would the body decide to put it in your big toe joint? I mean, for goodness sake.
It can put it in your ankle or the knee. I've seen it in the elbow as well.
Is it something that is diagnosed, or do you pretty much know as soon as someone comes into the surgery that they've got gout?
Well, it's pretty likely sometimes, especially in a big toe, because it is so sore and it's often very red and hot and very tender to touch. But we can also sometimes put a needle inside the joint, take out a little bit of the fluid, and then we'll see those uric acid crystals inside there to confirm the diagnosis.
So what's the treatment? Do you cut the toe off, or...?
I think some people probably wish they could cut their toe off when it's that sore. But no, there are medications to help relieve it immediately, and those are generally anti-inflammatory medications that take down the inflammation and the redness and the heat and the swelling. And then there are some tablets that you can take all the time to lower your uric acid level to try to stop it from coming back.
And some reading here something about needles into the joint.
Yep. Oh, very rarely. If it's very severe, we sometimes will inject a little bit of steroid into the joint, but that's not done very commonly at all.
So, what do we need to look out for? What are the signs? What are the symptoms? I mean, if I'm sitting there and go to bed and then wake up in the morning and go, something's not
Ow,
right.
it's sore. Yeah, you'd really know it
Pretty
was
much
there.
that's it.
It's sore.
It's that painful.
It's sore. It's that painful.
What a shocking thing.
Yeah, and it will go away on its own. You don't have to do something about it, but generally most people need some form of pain relief in that moment to actually, keep them mobile and able to do things. Yeah.
Unbelievable. Thank you, Dr. Cate. What are we talking about next time?
Oh, I don't think we've decided. What should we talk about?
Pick a subject.
Arthur's pregnancy.
Pregnancy.
Arthur's
pregnancy.
Arthur's pregnant,
Okay.
so we'll talk about pregnancy.
Let's talk about how to get Arthur pregnant next week.
Dr. Cate, always a pleasure. We shall return. We'll talk more after the break here on City News.